many factors are to be considered before placing an IV catheter in veterinary patients. Patient comfort and temperament may determine which vessel is used for placement. The handler's comfort also needs to be considered. When choosing a catheter size, consider the intended use of the catheter. For example, a patient that is going to receive or potentially receive rapid fluid administration, such as while under anesthesia, should have the largest bore possible. Short-term or temporary catheters can be smaller if the goal is to just have venous access. Supplies necessary for catheter placement are clippers, appropriate size catheter, prepping scrub, exam gloves, porous tape, saline flush, an injection plug and/or T-port extension set, and if desired, bandage material. The most common catheter insertion sites in small animals are the cephalic and lateral saphenous veins in dogs, and cephalic and medial saphenous veins in cats. Other less common sites that can be used are the dorsal pedal and accessory cephalic veins. Shave a large enough area around the intended insertion site to ensure no hair or debris will contaminate it. Typically, the leg is shaved circumferentially to avoid pulling out the hair upon removal of the catheter. The handler should hold the leg off proximal to insertion site to allow for visualization of the vein. Use a surgical scrub technique with either chlorhexidine or betadine, with an alternating rinse of either alcohol or saline. Exam gloves should be worn when scrubbing to avoid contamination. Dry off the area lateral to the insertion site with dry gauze to help the tape adhere more appropriately. Insert the catheter bevel up directly on top of the vein, ensuring the catheter is not contaminated by the hair or the operator. Once a flash is achieved, advance the stylet a fraction to ensure the catheter is well seated in the vein. Advance the catheter while holding the stylet still. Remove the stylet and either attach a T-port extension piece or an injection port. If possible, the handler may occlude the vein proximal to the insertion site to help prevent hemorrhage and ensuring that the insertion site is not contaminated. If using an injection port, place a single layer of tape prior to flushing to safeguard against accidental catheter removal. If attached to a T-port, flush catheter with saline to ensure patency. The first piece of tape is most important. Place this tape snugly around the catheter hub first, then wrap it around the leg. Using a narrow strip of tape such as 1/2 inch in width may be more helpful than using 1 inch width for this first piece. The tape should be long enough to go around the leg 2 or 3 times. Fold the last 1/4 inch or so of tape in on itself as a courtesy tab to aid in removal if necessary. Wrap an additional 1 to 2 pieces of tape snugly around the leg, tacking the catheter hub down and ensuring the use of courtesy tabs at each end. Make sure an injection cap is placed at the end of the T-port and secured in place. If desired, bandage material can be placed to help keep catheter site clean. To remove an IV catheter, make sure you first have a small piece of gauze and self-adherent bandage handy to use as a compression wrap. Use sharp bandage scissors and place under the tape, cutting through all the layers with care not to cut the skin. Remove the tape as gently as possible with care not to tear the skin. Once the tape is removed, place the gauze over the puncture site and wrap the self-adherent bandage 2 or 3 times around the leg for use as a compression bandage. The bandage should remain in place for approximately 10 to 20 minutes before removal.